Okay. All right. So, hi, everyone. Welcome back. This is here, you're with Abby and Scott again, and we are, we just prepared you to take a look at what the intake process looks like. And the next part of your simulation sessions, so session number 2, you'll work with a client where you're going to provide them with what we call psychoeducation. So really educating and validating their experiences around their mental health or contextual issues. And, how can we help to empower them so that, they can make good choices about, what it means for them to live a life worth living, if you will.
And I think empowering is a good choice of word, because it's also helping to level the power dynamic between therapists and clients. So we don't have to be the holders of knowledge. We want to share that knowledge and information with the client so they can understand themselves, not just us understand what's happening for them. And in doing so, it's making it more of a collaborative treatment where they can better understand and make choices. It's not just us knowing what the course of a certain illness may be and how that affects a person, but they bring their own awareness.
Yeah, because we know that, mental illness is often chronic, for some individuals. And so it's really about how can we enhance the quality of their life? How can they have autonomy in their decision-making process? And also, how can we empower their support system, their loved ones to also, quote unquote, play the role of a therapist with them, helping them, for example, to take medication or set up a schedule, for chores or things like this that might, around sort of life skills, if you will. Psychoeducation, as you all will learn about this week, actually came about from working with families where a client was schizophrenic, and how could they best empower the client about their illness in a way that was destigmatizing, knowing that chronic mental illness has so much stigma in our country, at least. And how could that be done in a way to empower the client and empower their family members too, to be an active and supportive part of having some positive outcomes. And I use psychoeducation all the time. I can't think of a time when I don't use psychoeducation in some form, whether it's about providing psychoeducation on the process of therapy and how you can gain the most out of the experience. But also, people will come in the door, we know, sort of the iceberg effect, right? Like it's the tip of the iceberg that they're sharing with us, but there's a lot of stuff underneath that they might not be aware of is influencing their issue. We were just, as an example, I had a client who was looking for work, but they weren't aware that they had some hygiene issues. So I had to provide some psychoeducation in a very humanistic, non-shaming way around, how do we, how often to take showers, when to brush your teeth, how to, wash your clothes, putting them away. And all of that actually, extending this when I did addictions work was really critical to preventing relapse,
Mm-hmm. Yeah. I think it's also important to name that in this context, we're sort of bringing a full session or 20 minutes of a session focus around psychoeducation. And that's sometimes how it might look. I have a professional that I supervise for licensure who, as part of their workflow, they run community meetings, they run music therapy and counseling groups, and they run psychoeducation groups. And so that part of their week, those psychoeducation groups, our entire group focused on a theme or a topic related to the course of treatment and is psychoeducation. In other instances, psychoeducation may just be sprinkled in here and there where it pops up, where a client starts talking about something and you're realizing they could benefit from having a better understanding of that concept or how something is impacting them in their life. So yeah, sometimes it's that big like whole session focus, and sometimes it's sprinkled in where it fits or it comes up naturally, and it's just a small piece of a broader session.
Agreed. And I would also sort of add to this, sometimes it's about me facilitating and providing information, but it can also, psychoeducation and engaging with it is as much a part about being in collaboration with my clients. So I might say, let's take a look at best practices in terms of routines for individuals newly diagnosed with bipolar disorder, and let's do it together, because it's as much about providing information as it is about engaging and seeking out the information and supporting that process for another. So there's a couple of steps that could happen.
And to realize that they're not the only one in the world in the history that has experienced this.
Yes.
Psychoeducation is a great tool to say, hey, look, lots of other people have experienced this or something similar. And here's some ways that have been shown to be helpful for that.
Absolutely. If you come out with nothing else, you are not alone. And that's really critical to hope and to positive outcomes. Mm-hmm. So you'll see Scott and I giving y'all a little role play, a little snapshot that is, just to ground you into what it might look like to provide a little psychoeducation around anxiety and mindfulness and coping, ways to relax, because your client for your sim session is anxious because of COVID. And so you'll be providing them some psychoeducation on, what anxiety looks like and how they can best cope, as we'll demonstrate here for you now in the role play.
And I'll be stepping back into role as a reminder from the first video and first sim experience as Sean Maslow, an adult who's experiencing anxiety around COVID, but has a prior diagnosis of generalized anxiety disorder, for which they received treatment during adolescence, but has sort of been managing on their own since then, and is having a kind of a resurgence in the midst of COVID experience.
Exactly. Great.
So I will do as we did last time. I'm going to hold a little sign up to the screen, and when we drop it, it'll be action.
All right. Hi, Sean. Welcome back. It's good to see you again. I'm so glad you made it back. We covered a lot of information last week, and it was really just about gathering some information and seeing where you were at with everything that brought you in the door. Actually, let me take a pause here for a second. Are you in a good space where you feel safe, where you can share, where it's safe for me to share openly with you?
Yeah, I'm in the same space we were in last time. Seemed to be good.
Okay, great. And I know you're really kind of suffering right now with the angst, due to COVID, and, you have this history of generalized anxiety disorder. And I thought, it's really been a while since we've kind of explored, since you've been in therapy and explored sort of symptoms related to GAD, generalized anxiety disorder. And I also want to make sure you leave today with some ways to cope, try out some new skills and begin there. But just to check in before I
think that would be helpful, because, I after our first session, I don't feel very different, but I have a little bit more hope that, talking to you and going through some time together is going to be helpful, but having some really, actual ways to do that today will I think feel good.
Yeah, I hope so. I really do. And just to show, there's a lot of different ways in which we can help you to cope with your anxiety right now. And this is just getting us started. So it sounds like, let me just do a check-in with you. It sounds like the last week was still pretty tough. Were you sleeping? What was coming up for you?
I mean, about the same. Still having kind of trouble falling asleep. When I do, kind of sleeping through the night. Usually wake up a couple times in the night, and then the other that makes the rest of the days harder, and definitely have less patience with the kids and things like that, and
definitely
other family members.
Absolutely, and totally understandable. That you're in that space. So if it's okay with you, could I share? I have a couple of resources I'd like to share. Would that be okay? Just as a place to get started, I wanted to share. I have sort of like a worksheet handout on what GAD is, and it would just help us to get on the same page. We'll be using the same language, Does that feel okay?
Sure. I'm kind of a visual person. Often I like to see things, laid out in that way. So I think that would be helpful.
Wonderful. I am the same way, so I appreciate your flexibility here. Okay. All right. So let's just do a little IT support here for a second. Do you see a form in front of you that says anxiety disorders and NAMI at the top?
Yep.
Okay, great. All right. So the first thing I just wanted to tell you, and I can provide you a link to this website, but there's this wonderful website called NAMI for short, the National Alliance on Mental Illness, and they have all kinds of free support groups and worksheets and just a plethora of free resources. And I don't want to overwhelm you, but I just want you to know that this is one additional tool we can add to your list in terms of places to go for support. But let's look at anxiety disorders together. And just to kind of go through here, let's look at some of your symptoms and see if this fits for you. So are you having feeling of apprehension or dread? So is it, how does the anxiety show up in your body? Do you feel tense? Do you feel
Yeah.
jumpy?
Yeah. Tense. Definitely like, I guess dread, especially like Sundays, like not wanting to start the week again. Yeah, tense. I mean, even and kind of the irritability piece. I think I look forward to the weekend still because I'm so used to like normal time when it's like Friday, yay, and Saturday, and I can relax, and yet I'm still very, irritable, and like I don't feel, it's like Saturday doesn't feel as good as it usually does. Like I expect it to, I'm excited for it, look forward to it, and then I'm still like feeling whatever's been going on all week, and I'm like still stuck home in the same environment I've been with the kids and the wife, and I find the weekend even isn't as enjoyable, even though I look forward to it in the same way, and then I'm kind of like disappointed because it's supposed to be.
Mm-hmm. And wanting to feel rested and a little less irritable for sure. So it sounds like you're having, pretty consistent emotional symptoms related to the anxiety that are pretty typical when you have an anxiety disorder. Does that feel sort of like what you remember when you, when you had anxiety back when you were a teenager? Anything different?
Yeah, pretty similar. I think, I think I had probably kind of less words to put to it then. It was more the feelings, but if I think back, yeah, probably a similar kind of like not looking forward to the next day or what's happening next kind of, yeah.
The dread, yeah.
And, I remember, I figured it was kind of just normal teenager stuff, but I would kind of fight with my parents a lot during that time. And I think looking back, probably irritability.
Yeah.
Irritability. Yeah.
Right. Hard to know if that's just sort of your general teen angst, that comes with that period of life or, related to the anxiety. I totally get that. How about any of the physical symptoms? Are you having any shortness of breath, sweating, headaches? We know you're having the insomnia.
Yeah, the headaches, fatigue, and insomnia one definitely feels accurate.
Any tummy upset or anything?
Yeah, I guess. Yeah, I mean, maybe I've had some like kind of upset stomach, not like nausea, but just like yeah, upset stomach, I guess.
Just when you're having all that tension and dread at some point, some of that will turn into, some tummy stuff, which is
Yeah.
pretty typical with anxiety. We really do feel it in the body. Okay. So it sounds, like you have what I would call just your run-of-the-mill generalized anxiety disorder. Or at least you're having those symptoms. And just to make sure while we're looking at this, any you haven't had any history of panic disorder or phobia? Anything like
No.
that? Okay. How
No.
about some social anxiety or anything like that?
No, I'm a pretty social person, although I've been less kind of motivated. Obviously, nobody's really doing much these days. So I think that's hard, like, because I don't have the social connection, but I'm also not like, I've been a little more keeping to myself too, even though I usually am more social.
Okay. Okay.
But,
Okay.
just reading that, what it says there about GAD, it mentioned like having a hard time concentrating. And I think that, that's definitely something I've been experiencing. And then getting frustrated when I can't finish what I need to. And it's kind of like a cycle because then I'm stressed about it, or, it's kind of weighing on me at night, I think. And I feel like I'm always just trying to catch up.
Yeah, and not only is that typical of GAD, but I would say, right now with COVID and everybody, experiencing a level of trauma, and really like we're, an anxious country right now, anxious world even. So I think, just to sort of to normalize where you're at and what you're experiencing, I think a lot of folks are in the same boat with everything that's going on. So So we've taken a little bit, we've had a chance to sort of look at, and it sounds like you have, just run, a run of a mill GAD, and we often call anxiety, actually anxiety or depression, sort of like the common cold in mental health. It's pretty common. And let me see, if I flip over to another tab, do I need to, do you see
I see what is mindfulness.
You do see what is mindfulness?
Mm-hmm.
Okay. Just sometimes it gets a little funky with IT, so I just wanted to check in. Have you ever heard of this word mindfulness before?
Yeah, I see it on commercials a lot and like different apps and things. I know.
Yes, yeah, there are a lot of good apps out there, and that actually might be another tool to consider. In terms of how to cope, and checking, how you're doing on the daily. But you're gonna have a so you're gonna work on cultivating mindfulness, and mindfulness is just about cultivating a certain state of awareness. It's being aware of your body and your mind. Oh, hold on one momente. I just need to pause us here. I'm so sorry. This is the issue with doing therapy at home. 1 second, someone's at the door. All right, so sorry about that pause there for a moment. Issues with doing therapy at home these days, but I appreciate your flexibility. So let's go back and take a look at our mindfulness sheet. And mindfulness, there's a lot of different ideas out there about what mindfulness is. It's really become fairly commodified, but there's a piece to mindfulness really around coming back to the present moment and focusing on your breath, along with, and this is really the piece that people forget about with mindfulness, sort of this radical acceptance of what's going on in the moment. And you cultivate this level of acceptance by continually engaging in mindfulness practices. And there's a lot of different ways to engage in mindfulness. We'll try just one experience today called the 4-7-8 breath. But you can do mindfulness meditation. If you don't like to sit and breathe, you can walk and breathe. Body scans, those are where we have some really wonderful apps out there. And we also have, just grounding yourself in the moment by coming aware of your senses. So, when you're starting to feel kind of that yuckiness in your tummy, that tightness in your chest, really breathing in through the nose and out through the mouth. And while you're doing that breathing, you're starting to focus in on your 5 senses and, what you can see, feel, hear, taste, and smell.
I mean, this sounds good, but like one of the things I feel like that's hard for me is I never feel like I have enough time for all the things on my plate between work and home and kids, and like, doesn't meditation take a while? Don't I need like a good chunk of time each day to do that, or each week? Like, I'm not sure I can fit it in.
You can, well, I think that's a realistic issue. And so maybe part of what we're going to look at, sort of more globally together is what is your schedule looking like these days, and where might we really plug this in to make it, really reality based. But what I would also say is, some of these exercises are no longer than, 30 seconds to a minute.
Oh.
And it really is about, doing it on the regular. So if you do this a couple times, let's say you did 3 minutes of mindfulness a day, that could start to build your mindful muscle. And the more you're building that mindful muscle, the greater degree and less of, less severe, will your anxiety symptoms be, or you'll be able to deal with them, cope with them better. Or that's the thought, we're going to try these out. It's the kind of thing we have to figure out what fits best for you. So this is just a beginning place for us. And so I have this 4-7-8 breath. Have you ever heard of this before?
No, I don't think so.
Okay. All right, this is like a real easy breath exercise to begin with right away to help bring you into the moment and just relax for a second. So what you do is you're going to breathe in through your nose for 4 seconds, and you're counting in your head and not fast, right? So 1, 2, 3, 4, breathing in like that through the nose. And then you're holding your breath for 7. And when you exhale, you're really going to kind of, you're going to make a whoosh sound or just really exhale. So,
Okay.
and, I'm not trying to, if it feels uncomfortable, just go as far as you can. But you're holding it in for 4, or you're breathing in for 4, you're holding it for 7, and you're breathing out for 8. So why don't we try that one time, and I'll count for you, and then we can go from there. So,
okay.
So go ahead.
I'm ready. Okay.
Okay, I just wanted to make sure you didn't have any questions. So breathing in through your nose, 1, 2, 3, 4, and then holding your breath, 1, 2, 3, 4, 5, 6, 7, and exhale. 1, 2, 3, 4, 5, 6, 7, 8. So what I would ask for you to do, I'd like you to do 4 of these breaths in a row each day.
Okay.
Okay, so maybe print this out, put it in your car. Maybe you do it, before you walk into the office, or right after you get out of the shower. Breathing in for 4, holding for 7, and out for 8. Okay. Just going to try that a couple times. So I'll be sending you these worksheets as well so that you have them to practice.
That sounds good.
All right, so that's one tool. And then one other tool I wanted to walk you through is doing a progressive muscle relaxation, because when you're really feeling tense, this can really help you in the immediate, to start feeling relaxation. But essentially what you're doing with this exercise is I'm going to be asking you to tense different muscle groups and release them. And when you're releasing them, you're also breathing out. So, and you can do this sitting up, you can lie down, really however you feel most comfortable. You can close your eyes, you can keep them open. It really doesn't matter. But you're essentially just going to be breathing and, maybe a little tension. For example, you saw my shoulders go up and then I release them. And we'll do that through several muscle groups. So how does that feel to you?
Yeah.
Are you open to giving that a try?
Yeah. I'd like to give that a try, and especially kind of understand if I need somebody else to help me with it, or if this is another one like the breathing that I can just do on my own. I guess when I initially heard the name, I was thinking like a massage, where
Oh,
somebody would
lovely. We'll have to add.
relax my muscles for me, but this is different.
This is different, yes. So you could pull out this worksheet and do this on your own sometime if you like. I mean, honestly, I would really encourage you to bring your wife or your family into this process with you and see if they might want to read the script for you. And in addition, if you go on YouTube, I promise you have there are thousands of videos of people leading progressive muscle relaxation. So then it's really just, pick your choice in terms of which one feels right to you. So, but why don't we give this a try, and then we'll sort of see how you feel, and we'll wrap up for today and talk about for next week if that feels good.
Yeah.
Okay. So first, I just want you to sit back and be comfortable. Close your eyes, just breathing normally. Comfortable just in this moment, letting go of everything on your lists and things to do, and just really, being kind to yourself, and just grateful for taking this moment. So first, I want you to begin by taking a deep breath and noticing the feeling of the air filling your lungs, and hold your breath for a few seconds. And as you release the breath slowly and let the tension leave your body. And take another deep breath and hold it. And again, slowly release the air. And even slower now, just taking another full breath. Fill your lungs, hold the air. And slowly releasing the breath, imagining the feeling of tension leaving your body. Now move your attention to your feet and just begin to tense your feet by curling your toes and the arch of your foot. Hold on to the tension and notice what that feels like. And then release the tension in your foot. Notice the new feeling of relaxation. Next, begin to focus on your lower leg. Tense the muscles in your calves. Hold them tightly and pay attention to the feeling of tension. And release the tension in your lower legs. Again, noticing the feeling of relaxation. Just remembering to breathe as you would normally, in through the nose, out through the mouth. And next, tense the muscles of your upper leg and pelvis. You can do this by tightly squeezing your thighs together. Make sure you feel the tenseness without going to the point of strain. And again, release. Feel the tension leave your muscles. Begin to tense your stomach and chest. You can do this by sucking your stomach in, squeeze harder and hold the tension a little bit longer, and release the tension. Allow your body to go limp. Let yourself notice the feeling of relaxation. Just continuing to breathe. Breathe in slowly, noticing the air filling your lungs, holding it in, and release the air slowly. Feel the air leaving your lungs. Next, tense the muscles in your back by bringing your shoulders together behind you. Hold them tightly. Tense them as hard as you can without straining, and keep holding. And release. Release the tension from your back. Feel the tension slowly leaving your body, a new feeling of relaxation. Notice how different your body feels when you allow it to relax. And then tense your arms all the way from your hands to your shoulders. Make a fist and squeeze all the way up your arm and hold it. And release the tension from your arms and shoulders. Just noticing the feeling of relaxation in your fingers, hands, arms, and shoulders. You might be, moving your fingers just a little bit, allowing your arms to feel limp and at ease. And move to your neck and to your head. And tense your face and your neck by distorting the muscles around your eyes and your mouth. And release. Again, noticing the feeling of relaxation. And finally, tense your entire body. Tense your feet, your legs, your tummy, your chest, your arms, your head, your neck. Tense harder without straining. Hold that tension. And release. And allow your whole body to go limp. Pay attention to the feeling of relaxation and how different it is from feeling of tension. And just very slowly now, begin to wake your body up by slowly moving your muscles. Adjust your arms and your legs, maybe wiggling a little bit. Just stretching. Take your time, but open your eyes when you're ready. All right. So that was one more tool that you might try. So what I'd like to see, well, actually, let me take a pause. How are you doing right now? What was that like for you?
That felt pretty good. I think at first I had a hard time focusing. I was still kind of thinking about other things, but as you went on, I was able to just listen to your voice a little more and follow the directions.
And that's really common. I think the misperception of mindfulness and these breathing exercises is that, your mind should be really clear and you're not having any thoughts. And that just isn't true. We all have what we, affectionately call in the mindfulness community, monkey mind, just going from one topic to the next to the next. And the exercise is really just about coming back to the here and now in the present moment over and over again, using your breath as an anchor. So what I'd like for you to do is to, try that 4-7-8 breath, let's say 2 to 3 times, 2 to 4 times a day, and to track it. So this is where the apps might come in handy. And also to try, if you can, to do, what feels realistic for you. Actually, let me check in. How about the progressive muscle relaxation? Do you feel like you could do that maybe once a day or once every other day, maybe with your wife before bed or with your kids first thing in the morning? I'm just thinking it might be easier if you involve your family.
Yeah, I think before bed was a good idea once the kids are out of the way.
Yeah, okay. That sounds like a good plan.
I just imagine them jumping on me as I'm trying to breathe and relax, and it doesn't feel so relaxing.
Well, you know what? That makes me think maybe next time we also talk a little bit about some exercises you can do with your kids, because there are some, mindfulness is for everybody, and it's a lifelong skill we can work on.
Yeah, I think the breathing one I would try with them. With that
awesome.
4-7-8 one.
Great. Well, I want to be mindful and respectful of your time. So I'm going to wrap us up for today, but I know we have an appointment scheduled for next week. And we'll explore how you did with these coping skills and go from there. Does that sound okay?
Yep, that sounds good. And before we end the recording, I'm going to step out of role back into Scott for a second, because I just wanted to bring everyone's attention to how Abby's voice changed when she led me in the progressive muscle relaxation in particular. So as you think about the types of mindfulness and relaxation techniques you might try out, that's something to pay attention to. Abby's voice softened, deepened a little bit. and was slower too. Her rate of speech was slower. So I was really able to listen to her voice and let that guide me. But I could hear a difference in her speaking from when we were just talking, you know, conversationally to when she was leading me in that relaxation.
And if you do have a client who is elevating in their anxiety, pacing your voice and the tone of your voice is actually how you ground them again. That's a critical piece of it. So this is a good practice for that as well.
Mm-hmm.
All right. Have a wonderful learning experience, and we'll talk to y'all later. Thank you.
Bye.